I'm Florence Rolston. I am a physician. I'm an obstetrician gynecologist, and I am in practice in Southampton, New York. Well, mammograms are a very important screening tool for early detection of breast cancer. And mammogram is very useful in finding breast cancers before they can even be felt on a physical exam. For people who are over the age of 40 or people who are at an increased risk for breast cancer based on their family history or their genetic history, it's important for them to get mammograms done every year. Usually patients come in to have their clinical breast exam, and then we order their mammogram following their clinical breast exam. Well, it depends on the age that their relative was when they were diagnosed. So, for example, if someone has a mom who was diagnosed with breast cancer at the age of 45, let's say, then they should probably start getting their mammograms done at least 10 years before the age that their relative was when they were diagnosed. So if mom had breast cancer at 45, the patient may choose to start at age 35 to get their breast screening done. In addition to that, they may want to consider getting genetic testing to see if they carry any mutations that put them at an increased risk for breast cancer. It depends on the family history. Patients with a positive family history, especially in a first-degree relative like a mother or sister or daughter, often can get coverage for that genetic screening, which is done through a blood test. Many companies offer screening even if the family history is not so significant, and the cost is roughly about $300. Well, it depends